thank you very much for coming along today. We're going to discuss two cases. Very keen, in a way like a Schwartz round, that you should think about what's going on, reflect on what's going on as you hear these stories, and we're very keen to hear your observations and have your input.
So from a case point of view, this was a 72-year-old gentleman with a significant medical history. He continued to deteriorate over the course of his stay, and then picked up a hospital-acquired pneumonia as well, and unfortunately passed away after about a month's stay in hospital.
The review is asking somebody who is not on that team to review the case notes and do a very careful review from the first 24 hours or so of admission, continuing care, and then of course the phase just before the patient died.
What I've done is this structured judgment review of the case, and the overall seems that all steps were taking towards sorting the patient's problem, involving other teams in the care, considering them experts. Sounds again a good idea to being as a good practice. I'm giving an opinion as a professional, in the same time as a doctor, in the same time as a simple person. What is my feeling about what was happened?
When I was told that one of my cases would be discussed, I didn't ask if it was a good case, a bad case, if something could have been done better. For one simple reason, we work and live in a no-blame culture. I know when he did it, he looked very closely at the case, and it was an extensive case. And he doesn't look for fault, but he looks for where things might have gone wrong, where things could have gone better. It's nice when someone takes a step back, has a look at it from the outside, because that gives you an opportunity to piece apart what is your emotional involvement in the case, was the medical care done properly, and is there anything that could be learned or improved upon.
Some of the key themes today were about recognizing when death was approaching and having those conversations, sometimes with the patient if they were awake and alert, and the two patients we talked about today were, and then the further discussion about resuscitation, about the importance of involving the team in decisions about resuscitation so they're aware of the decision that was made. We'll be reviewing what happened today. Was this a format which people feel of value? Is it something that we can spread more widely, reach out to more people? But Paul Murray, as Head of Patient Safety and Deputy Medical Director, and Mark Hinchcliffe will be talking about this, and I'm sure we'll be providing a program which will be advertised widely. So hope as many people can come to that as possible.